So Dr. Supriya Ganesh, Sri Ganesh, a triad of signs to confirm successful implantation of a trabecular microbypass device.
Good afternoon, judges. A very good afternoon to the judges. Today I'll be talking about a triad of signs to confirm the successful implantation of a trabecular microbypass device. In recent years, microinvasive glaucoma surgery has offered lower medication burden and complication rates. Today we'll be speaking about the iStent Inject. It's composed of titanium and has a characteristic head, measures 360 microns in length to 30 microns in width, and contains 4 inlets for the passage of aqueous. The narrow body contains the lumen. The head sits within the trabecular meshworks, and a flange secures the device on the inner wall of the meshwork. The injector has 2 preloaded stents at a time, and it provides the ability to insert multiple stents while entering the eye only once. This paper aims to discuss the guidelines to implant the device and its correct position for optimal functioning, and we have described a triad of signs which can be used as a tool for assessing the successful implantation. Now, 16 eyes of 13 patients with mild to moderate open-angle glaucoma underwent phaco with iStent Inject implantation. Inclusion criteria was patient above the age of 18 with open-angle glaucoma on 1 to 2 anti-glaucoma medications with a need for cataract surgery with visual acuity of 660 or better. Patients with angle closure traumatic glaucoma, uveitic glaucoma, congenital, etc. Were excluded, and any patients with active corneal dystrophy or opacities that would impair the stent visualization and placement, and any other pathologies apart from cataract and open angle glaucoma were excluded. Now, the surgical procedure, the pupil is constricted with Pupil is constricted with pilocarpine after IOL implantation. 2% sodium hyaluronate is used to maintain the chamber. The sleeve is withdrawn after entering the AC. The trabecular meshwork is identified with the blood in Schlemm's canal. The trocar is placed in the trabecular meshworks, indented slightly, and the button is pressed on the injector to inject the iStent device. And without releasing the button, the injector is withdrawn and the button is released. The ooze of blood after injection indicates that the iStent is in the Schlemm's canal. The steps are repeated for the second site. Pressurizing the eye or overpressurizing the eye will lead to a blanching effect on the conjunctiva, which is described as the blanching sign, and intraoperative OCT is used to look for an accumulation of fluid under the conjunctiva called the fluid lake sign. So these are the 3 triads which we will be demonstrating here. So here, as you can see, the direct gonioscope which is provided is used to visualize. After injection of the iStent, there is an immediate ooze of blood, and this is the first sign which is described. This is the second device which is implanted 2 to 3 clock hours apart. The second sign is on overpressurizing the antechamber. Just notice the blanching of the superior blood vessels. This is called the blanching sign. The third sign is the fluid lake sign on intraoperative OCT. Here you can see it goes from an area of, not the area of iStent implanted. So the conjunctiva there was quite flat, and here this is the area of the iStent implantation. So the conjunctiva is wavy, and there is fluid accumulation under the conjunctiva. This is only on overpressurization and it is attributed to a leak from the veins. So the results in the 16 eyes, here we see that the preoperative IOP in 10 of those eyes was less than 18 mm of mercury, and in 6 of those eyes were more than 18 mm Hg. And the mean IOP reduced after iStent implantation. On post-op day 1, there was a spike. The mean increased from 16 to 19. On post-op 1 week, it came back down to 17, and on post-op 3rd week, it came down completely to 15 and stabilized over 3 months to 6 months and came down to around a mean of 14 millimeters of mercury. Here we can see 2 of the patients in which we did not see all the 3 signs. Only the first sign was observed, where there was a a mild ooze from the site of implantation, but the second and third, the blanching and fluid lake sign, were not seen. And in these two patients, we see that there was no significant lowering of IOP after the iStent implantation. And this is the same thing that we see. 14 of the patients were taken off all anti-glaucoma medication. 2 of the patients had to be put on 2 anti-glaucoma medication even after the iStent implantation. These were the outcomes. And to conclude, I would like to say that this indicates that the triad of signs is a reasonable marker for accurate placement of the iStent. Thank you very much.
Thank you very much.